Multiplex immunofluorescence staining is a powerful technique that enables researchers to simultaneously examine multiple proteins within a single tissue or cell sample by employing various fluorescently labeled antibodies. This method allows for the visualization of protein interaction and their spatial distribution within the sample. This technique provides several advantages over traditional methods, including enhanced sensitivity and the capability to study complex biological processes in their native environments. It is especially valuable in fields such as cancer research, neuroscience, and developmental biology, where understanding this interaction between different protein and cell type is crucial. Okay, in this overview, we will discuss the fundamental of multiplex immunofluorescence staining, including selecting appropriate reagent, optimizing the staining protocol, and capturing image. We will also highlight some practical applications that demonstrate the significance of this technique in scientific research.
There are several traditional methods used in tissue staining, such as messenger cross and peroxide acid (PES). But the most common is H&E staining. Hematocyanine and eosin are two dyes that were used to highlight different structures in tissue sample. The hematocyanine dye, with its stem cell nuclei, are purplish blue. This helps to easily identify the cell nuclei under a microscope. On the other hand, eosin is will stain the extracellular matrix and cytoplasm pink. The contrast between these two colors makes it easier to differentiate the various structures within the tissue. The main goal of H&E staining is to help differentiate cellular and tissue structures. It's widely used in medical pathology to identify the abnormalities in tissue like cancer and disease. Firstly, H&E staining has limited specificity for cellular components. While it's useful for general cell structures, it does not provide detailed information about specific molecules or structures within the cells. This limits its effectiveness in identifying certain cellular details that might be important for diagnosis. Second, H&E staining is adequate for complex tissue and multi-color labeling. H&E staining with only two colors is limited for complex tissue or where multiple markers are needed, making it harder to distinguish detailed structures or various cell types in sample. Lastly, H&E staining is difficult in detecting disease markers. Many specific disease markers, such as certain proteins or genetic markers, do not show up with the additional H&E staining. In addition to the challenges, there are also some notable effects of using the traditional hematocyanine and eosin H&E staining method. Firstly, there's the issue of reduced diagnosis precision. Since H&E staining does not provide specific markers for individual cellular components, it can lead to a less precise diagnosis. This is especially problematic for identifying subtle differences in cell structure, which may be critical for detecting certain disease early on. Secondly, inconsistent staining quality can be a problem. The result of H&E staining can vary due to differences in staining, reagent quality, and other factors.
In recent years, the demand for more precise and detailed information from a tissue sample has been increased, pushing us to develop methods that can capture multiple data points in a single test. Hence, multiple immunofluorescence, or we call it as MIF, enabling us to gain more complete view of the cellular interactions, marker expressions, and the tissue environments in a single assay. Before we dive into how this method operates, let's briefly review its principles. The principle of the MIF is enable the quantitative measurement of the multiple stains in a single slide, facilitating the assessments of antigen co-expression and spatial relationship within the clinical setting. within the clinical samples. This technique utilizes antibody recognition of the target's antigens followed by the tyrosine-based fluorophore binding to the tissues. It requires multispectral imaging and a digital workflow for accurate analysis. Okay, how does the MIF method affect the diagnostic process? Okay, the MIF method speed up diagnostic process by allowing multiple biomarkers to be analyzed from single tissue sample, reducing the needs for the extra tests and ensure more data-limited samples, conserving the tissues and providing detailed image combined with the AI-based analysis speed up the interpretations and reduce the human error. Okay. With the detailed information provided, the specific cellular landscape within the tumor or disease sites can be revealed, which is crucial for the clinicians to tailoring the treatment for the patients. For instance, that knowing the level or location of the protein, such as PD-1 and PD-L1, can indicate whether the patients may respond to immunotherapy, hence allow the clinicians to predict how patient may respond to the particular therapies and provide more personalized treatment plans. Okay, everything has its own pros and cons, and MIF is no exception. While this advanced technique is highly efficient at targeting specific tissue for detailed observations, it involves a more complex procedure compared to the traditional method, which is patient methods. Okay, using the multiple fluorophore can lead to the spectral overlap, complicating the interpretations and potentially cause a marker misidentification that could lead to misdiagnostic of patients' diagnosis. Okay, this requires a high-level technical expertise among the staff. Additionally, the high cost of the MIF can be limit its accessibility. So these methods, for now, are more accessible for the research study compared using in the hospital. The MIF method reveals the presence and spatial distributions of immune cell, stroma cell, and cancer cell by using antibodies specific to each cell type, which are labeled with the distinct fluorophore. Okay, this fluorophore emits different color when exposed to the light and allowing for the simultaneous visualization for multiple cell types within a single tissue sections. Okay, there are 4 common fluorophore that were used in this MIF method. The first one is the blue fluorophore. It's paired with an antibody to Ki67, which is a proliferation marker. It could identify the proliferating tumor cells. And then the second one is the red fluorophore. It's linked to an antibody for CD68, which marks the macrophages. And then the third one is the green fluorophore. It's marked conjugated to an antibody targeting CD3, which also could identify the T cells. And then the yellow fluorophore could be used for markers like PD-L1 on tumor cells or other protein relevant to the treatment response. Okay, the second benefit of the MIF is it helps minimize the tissue loss and antigen damage. Sometimes when you do a traditional method, we tend to roughly dip into the solution or reagents, so and then it can make some of the tissue loss from the slide. Okay, unlike the traditional methods that require multiple tissue sections for each antibody or stain, this MIF method allows the use of a single tissue section to detect multiple biomarkers simultaneously. This could minimizing the tissue loss. Additionally, the sensitivity of the fluorophore conjugated antibody in MIF enables the detection of the smaller amounts of antigen without harsh processing, reducing the risk of antigen degradation and ensuring more accurate results compared to the traditional methods such as H&E methods. Okay, and then the last one is help uncovering biological interaction. Okay, each cell type expresses a unique set of the protein, and different fluorophore are selected based on their emission scalar and conjugated to antibodies specific to each marker. Okay, for example, like overlapping green, which is the T cell, and with red dye, which is mark of the macrophages, to highlight areas of immune response, with yellow fibroblasts and the purple, which is the collagen fiber, might show how fibroblasts contribute to the tumor stroma, influencing the tumor growth and metastasis through the production of the extracellular matrix components. Okay, these visualizations help reveal complex interactions and special relationship between the different cell types within the tissues. Okay, and then this method providing the deeper insight into the disease mechanism and potentially therapeutic targets and help the clinicians to provide a better treatment or suitable treatment to give for the patients.
So in the conclusion, while conventional histological methods remains useful, the adoption of the new technologies in histology is revolutionizing the diagnostic landscapes. These advancements not only enhance the diagnostic accuracy, but also improve the efficiency and the ability to deliver faster, more personalized care. The integration of molecular staining, automations, and digital pathology has empowered the pathologists to make more informed decisions, which ultimately translate to a better patient outcome. So, as the technology continues to evolve, we can expect further improvements in the diagnostic workflows, providing even more precise and comprehensive data for the assessment and treatment of the disease. This shift from the qualitative to quantitative, manual to automated, and the traditional to digital represents a new era in histopathologies where cutting-edge tools align with the demands of the modern medicines to deliver superior health.